This is my first trip to Scandinavia. I'm very happy to be here. My wife and I got to spend a couple of days in Stockholm, and I learned a lot. In particular, I took great pleasure in being able to visit the Nobel Museum. It's a wonderful place. I've spent a lot of time myself thinking about science over the course of my life. My life never depended on it until a few years ago when I discovered I was almost dead. I have about an hour of material to present in 20 minutes. I'll try to be kind about it. There's much more on my website. I myself am a graduate of this college in Boston, MIT, and we have a reputation for being a little bit overly scientific and nerdy, but I want you to meet one of my classmates, Iron Man, who was a graduate of MIT with the MIT ring, and he had, this ring appeared, that's a beaver, the engineer of the animal world, and it appeared in another famous movie, The Hobbit, where it was secretly the one ring to rule them all. A senior doctor at my hospital, Beth Israel Deaconess in Boston, named Warner Slack, has been saying since the 1970s, it can be argued that the largest yet most neglected healthcare resource worldwide is the patient. Now, I'm somebody whose life depended on the best in medical science. I am not medically trained, and we have to ask ourselves, if we want to be serious about this, what's going on if this senior physician can be saying something like this? I will make the case to you in the next few minutes that something real has changed. It does us no good to just think, if we think lovely thoughts about patients, the world will get better. Whether you're a business person, a medical professional, a government policy person, we need to understand what has really changed. A very short version of my cancer story is that 7.5 years ago, I went to the doctor and discovered out of nowhere that I was almost dead with kidney cancer. I had tumors in one kidney, in a leg bone, in both lungs, in my arm, in my skull, and even in my mouth. I had the kidney cancer tumor growing out of my mouth. Grade 4, stage 4 renal cell carcinoma, and at the time I was diagnosed, the best available data said that my median survival was 24 weeks. I'm not exaggerating. This is exactly what the situation was. It was a silent killer. There's more about this whole story on my website, but a really important thing happened, which is that my doctor prescribed ACOR. It was an online community of other cancer patients with the disease, not supervised by doctors or researchers, just talking to themselves about what was important to them. And they had one thing in common, which was their life was at stake as to how well it all worked out. Consider, in the first 2 hours after I joined this community and posted my first question, they came back and said, this is an uncommon disease. Find a hospital that does a lot of cases. There's no sure cure, but this stuff called high-dose interleukin-2 sometimes works. It usually doesn't, but when it does, about half the time it's complete and permanent. Here I am, 7.5 years later. My doctor's only complaint to me now is not about the cancer. He says I have to lose weight again. This is good. I like this problem. But they said the side effects are severe. Sometimes they kill patients. That's why you have to find a specialist hospital. Don't let them give you anything else first, because this won't work so well. And here are 4 doctors in your area who do it. And one of them was at my hospital. Ladies and gentlemen, I submit to you, this is useful information, but you know what? It does not exist in the scientific literature. Not only that, but my oncologist has said, yes, they're right. All of this is true, and it's not in the literature. This shakes the foundation of the Nobel Museum. But we'll be talking about this because it does not indict science, but something has changed. For me, surgery and this material, high-dose interleukin-2, worked. That's a big tumor the size of a golf ball in my left lung at the time I was diagnosed, and 50 weeks later, that tumor had shrunk. They never even cut me open to take out all the other tumors. This is an immune system drug, and it works. And here's something fascinating. I said this is not an indictment of the scientific establishment. A year ago, the British Medical Journal asked me to submit an essay about my experience there, and they put the headline on it, How the E-Patient Community Helped Save My Life. Now, e-patient is a term we have for empowered, engaged, equipped, enabled, educated about evidence, and so on. It is a patient who is not a passive recipient of medicine, but who works with the doctors and nurses and everyone else. In fact, in this editorial, in this essay, my oncologist, David McDermott, one of the tops in the world, agreed to be quoted saying, "You were really sick. I don't know if you could have tolerated enough medicine if you hadn't been so prepared." Think about that. Put yourself in this situation, yourself, your mother, your child, somebody dying of kidney cancer. All right, there's only one chance to survive, and the side effects might kill the patient, whether it's you or your loved one. My reaction was, okay, where do I train? Where do I get my preparation? Like running for a marathon, you train for a year. Well, there was nothing in the literature. I went to the National Institutes of Health, the Kidney Cancer Association, everything like that. No advice. So I turned to my patient friends, and they knew exactly why I was interested in this. And I got 17 stories from people who had done it. And that's what I've prepared myself with. And today my oncologist says that helped save my life. Ladies and gentlemen, I assert that's useful information. So now, remember, I'm an MIT graduate. I am not anti-science. The question for the scientific mind is, how can it be that the most useful and relevant and accurate information could possibly exist outside of the literature? All right? Well, the founder of our movement, a doctor named Tom Ferguson, was working on a paper, a manifesto, when he died. His colleagues finished it after. And he interviewed a lot of interesting people. Donald Limburg is the director of our National Library of Medicine. And he said that when he was a medical student, he was taught that you would go home and read 2 articles every night. He said, if I did that today, I'd be 400 years behind after 1 year. There's too much information for anybody to keep up anymore. This means it is not an indictment of a doctor if a patient has seen an article that the doctor hasn't. In fact, it is now much worse than this. The actual number today is 1,100 years behind, because there are over 2,000 articles published every day now. Ferguson also published the lethal lag time. There's a delay between the moment when a researcher finishes something and the time that it gets published. Goes through the publication process and lands on your doctor's desk. And that delay is 2 to 5 years. Ladies and gentlemen, if you have a median survival of 24 weeks, that's a big problem. And it is not your doctor's fault that they may not have seen it. See, what's happened is information is moving around a lot faster than it used to. See, what we now understand, this is a generic network diagram, but now we understand that information is like a nutrient in the body. It makes possible a healthier response. And now we understand that these little dotted lines, these network connections, are like capillaries carrying blood and everything through the body. So the dynamic, what has changed today is because of the internet, information nutrients can now flow in unpredictable directions, and real, valuable stuff can show up at the point where it's needed. One final finding that Ferguson had was death by Googling. Oh no, stay off the internet, you'll kill yourself with bad advice. Well, he went searching for real examples because he wanted to warn people. This was 10 years ago. 0 cases. He found in 3 years, he found 0 cases of death by Googling. He found people who did stupid things, who hurt themselves or didn't help themselves, but he found nobody who died. So he published it. He started a journal, the Journal of Medical Internet Research now, and it's a high-impact, well-established journal. And Ferguson pointed out, you compare that with the data on health statistics, on patient safety and harm in American hospitals, at least 100,000 accidental deaths per year. And Ferguson said something very smart. It may be more dangerous not to Google your condition and educate yourself about what should be happening. I had no idea. This is what I was doing, but I had no idea that any of this existed. And Ferguson added something important that brings us back to Nobel. These conclusions are no more anti-doctor than Copernicus and Galileo were anti-astronomer when they said, maybe the Earth is not the center of the solar system. Patients can simply contribute more today than in the past. Louis Agassiz said something fascinating. Our problem here is that people in the establishment who have been trained that reality is one way naturally resist change, okay? Agassiz said this: every scientific truth goes through 3 stages. First, people say it conflicts with the Bible. Second, they say, oh, well, okay, but we already discovered that earlier. And then finally, when it's all widely accepted, they say, well, I always believed it anyway. And he said this back 200 years ago, okay? Where did I find this quote? I found it yesterday at the Nobel Museum here in Stockholm. And in fact, there were so many fascinating things. I was just taking picture after picture after picture after picture. They actually have this on the wall of the Nobel Museum. Such an important quote. Now, my wife and I looked through the history of everybody who's gotten a Nobel Prize in medicine, physiology or medicine, and I'm going to point out a few of them to you because this is the obstacle we face in transforming the culture of medicine. The obstacle is that so many people, is that medicine itself, because they are taught to be scientific and rigorous and evidence-based, they resist new things, sometimes for a tragically long length of time. Here's one example. Peyton Roux discovered that a malignant tumor in chickens may be caused by a viral infection. This was in 1911. He discovered that a cancer can be caused by a viral infection. It took time before the scientific community was convinced. So his work went unused. He did not receive his prize until 1966, 55 years later. If you are in technology, if you are in business, how would you like it if you had developed an innovation and it sat unnoticed for 55 years? Well, you know, if you are in ICT or digital health and you are looking to get ahead of the people who can't keep up with you, this is really good news because all you have to do is find people who are ignoring reality. I'm not kidding. And if you are in medicine and you don't want to get beaten out, then you had better wake up, change your thinking about how the world works. Here's another one. Barbara McClintock, she discussed her research about jumping genes, genes that could move around in corn in the 1940s. Nobody took her seriously. It wasn't until 1983 that she got her Nobel Prize. 40 years. Another one that's my personal favorite is this guy, Barry Marshall, Australian researcher. Some of you probably recognize his name. This was about stomach ulcers. He and his colleague, Robin Warren, suspected that the bacteria H. pylori could cause this disease, but they couldn't make it happen in animals. And so after years of being ridiculed by other scientists said, no, we know that this is something inscrutable. You just have to burn it out. And of course, there were people who said that ulcers were caused by psychiatric problems, so you have to go to a psychoanalyst, and that nothing worked. Well, he ended up drinking a cocktail of the bacteria in front of an auditorium to say, look. And he gave himself an ulcer. And 20 years later, it still took that long for his finding to be accepted. And if you go to the Nobel Museum, you can see that actual glass sample jar that he used to drink, and they have it mounted on display in front of a Frankenstein comic book, Dr. Marshall and the Scourge of the Stomach. And so the people with the pitchforks and torches coming to get him saying, "Infidel, traitor," because he was attacked for saying something that went against the established view. And perhaps the most famous of these cases was Semmelweis, who discovered that the tragic rate of childbirth infection, killing young mothers and babies, that washing hands reduced mortality to below 1%. We didn't know yet what germs were about, and so he was attacked because there was no rationale for why his method worked. I mean, it worked, but people still said, no, that's ridiculous. He could offer no acceptable scientific explanation for why it worked. So the result of this is that new knowledge has rotted in the field for decades while people who need it suffer. This is inhumane. It's a huge economic inefficiency if you're a business person, but it's also a huge opportunity to improve value by innovating. See, at MIT, we have pure science. I knew people who were working in the physics department on the nature of existence, pure science. But we also have engineers who want to make products that work, that people can use. So science and engineering are both valid. I say let patients help. Now here's where we get to the meat of what has changed, okay? To do this, we'll have to understand Venn diagrams. It's simple. Venn diagram means the things in one circle are A, red, male, whatever you might want to say. The things in the other circle are B, and the part in the middle is A and B. Very simple. Well, one of my colleagues and friends is Dr. Silke von Eisenwein from Emory University in Atlanta. I met her at a conference where she was presenting a poster, and she just really likes Venn diagrams. She talks about them. Well, earlier this month, the news agency Thomson Reuters made a big mistake on a marketing slide that they published. They showed this. They didn't realize that this looked like a Venn diagram. So on the left side, we have trust, partnership, innovation, and performance. And on the right side, it said our values, and there was no overlap. People. And not only that, but they do science reporting. So let's take a look at the paradigm in how value works in medicine. Okay? On the left side, we have physicians. On the right side, we have patients. One thing the patient has is they know, I have a problem. Well, and on the left side, physicians know about cellular biology. They have incredible training about this. They know what the patient's status is in numbers. They can say your hemoglobin A1C is this and your weight is this and so on. They know what the literature says. They know what treatment the patient probably needs. They know how to do it. They know what things could the problem be. How do you do a differential diagnosis? And the patients really, in the current paradigm, don't know much about this. All right, now you've already seen that from the ACOR, from the patient world, this may not be true anymore. Well, there's a university in Nijmegen in the Netherlands on the German border where they published this chart 4 years ago. Am I out of time? Really? That's, goodness. Well, all right, so I'll run through this very quickly. Okay, and this matches exactly what Pascal talked about. In the old days, all knowledge came in the 1.0 direction from the institution down to the individual. And now in the 2.0 world, that knowledge is going back and forth. And in the world of the future, we'll all be swimming in a common pond of information. This is you on the internet. And this is what is similar to Web 2.0 when the web began to go back and forth. And what we now understand is that this is not just some magic, but that patient has their network with them. All right? That's what has changed. They have capillaries bringing them information. And in fact, we all have that. And social media makes information liquid, and that changes what's possible. I'm going to skip ahead to the last section, I want to share with you that when assets digitize, things move fast. By the way, I bought a dozen Nobel Prize medals made of chocolate to share with whoever comes up and gets one first. Think about other industries, okay? Jay Leno is a TV personality who has a 3D printer to make parts for his antique cars. Big, expensive thing. Did you know that 3D printing is coming to all parts of medicine? You can get a knee replacement part made from your scan data, custom printed, so you don't have to replace both parts of the joint. 3D printers are helping scientists grow a replacement ear. In April this year, it was announced that a Japanese company now, from my scan data, can print a practice kidney for my surgeon, with white where the tumor is and black where the healthy tissue is, so the surgeon can practice. Think how this is improving what's going to be possible in medicine. Then just last month in Australia, they managed to print some individual kidney cells, and they have let out a contract now to 3D print a replacement kidney. Well, I said, all right, well, I know what happened in my industry before when it got digitized. 3D printing will move down market to consumers sooner or later. Well, at Christmas, I came down the escalator at a shopping mall, and there was a stand that said, 3D print yourself. And I went to their shop. Indeed, their biggest market is weddings and science fiction characters, of course. Well, I went and got myself scanned, and ladies and gentlemen, let me introduce you to Mini-Me. The quality will get better, the price will get better, but it's actually happening. In closing, William Gibson, the science fiction author, said, "The future is here, it just isn't evenly distributed yet." When assets digitize, things move fast. The most underused resource in healthcare worldwide is the patient. The world is changing. It is not anti-science. It is a shift in science. Thank you for your attention, and I hope you'll hear echoes of this for the next 2 days.
Thank you. Thank you so much. Thank you.
Thank you, Dave.
Thank you. We can really feel your enthusiasm and all that you want to convey to us. But I saw your TED Talk. I've seen many of your speeches actually online. And one thing that really got to me was that you really want to stress that give us our damn data.
Yeah.
Can you just, super short, just elaborate a little bit on that, please?
This is an experienced TV coach, right? Super short. Well, simple. One of the common problems that people have, medical professionals have, is they say they'll use a term or they'll talk about a condition or something, and the patient doesn't know what they're talking about. Well, when I testified in Washington on health policy, I said, until people get experience with something, they're inexperienced. And it's a mistake to judge people's potential based on how they do when they're brand new. A perfect example of this is that when my mother learned to drive a car, within a few months she had an accident, and in those days jokes about women drivers were happening all the time. Today, because most women didn't know how to drive yet, today insurance statistics say that women have fewer accidents than men. So it's the same thing. And I can't be on top of my situation if I can't see my data. My doctor says, how can patients participate if they can't see what I see?
Because that will lead us to talks that we will have later. Whose data is it anyway? So thank you so much, Dave deBronkart.
Thank you.
Thank you.
Am I staying up for a panel?
Sorry?
Am I staying up for a panel?
Sorry?